all the attendees, we ask that you keep yourself on mute. You can raise your hand during the webinar, or even better, you can send your questions in through the Q&A function while the webinar is going on. Okay, and for those of you who are here, you probably already know, but let me just do a quick introduction. This is a cardiac rehab webinar, and we're looking at people who have been through a cardiac event and are looking at rehab options after this. Again, there will be a time after the webinar to answer all the Q&As. So we ask that you submit all the Q&As through the proper function, and then we'll address them at the end of the webinar. Okay, so we're going to get started. I'd like to introduce Mr. Hung Yong, okay, Mr. Tay Hung Yong, who is the Senior Principal Physiotherapist at Rehab Paradigm, okay, and he's here to give a little bit of a webinar on cardiac rehab and what that means.
Well, thank you. Thank you for inviting me. Thank you, Speedoc. So, okay. Yeah, let's get started.
Yeah, just go through the agenda of the day first, and then we'll go into, some of what he's going to share today. So the agenda for today, we're going to talk about what actually is cardiac rehab, who needs cardiac rehab, the importance of support, how we're doing it at home, and improving your heart's future with Speedoc. And then, of course, we're going to Q&A. So one more guideline, we ask that you don't submit, personal questions in the Q&A, because all these will not be able to answer if we don't have a full medical history. So it's not going to be really conducive. We ask that if you have generic questions, of course, please do share. We'll do our best to help. Okay, so Hung Yong, maybe you can start off. What actually is cardiac rehab?
Right. Okay. Cardiac rehab is actually a program of exercise and lifestyle interventions offered to heart patients after a heart event or procedure. So it is designed to help heart patients to get back on their feet, both physically and mentally, after a heart event and procedure. So some examples of a heart event would include a heart attack, a coronary artery bypass stent grafting, an insertion of a stent or a balloon, or implantation of cardiac electronic devices such as a pacemaker.
Okay, so let's go on to the next slide. Okay, so why is cardiac rehab important? What does it mean for people who have suffered like cardiac events?
Cardiac rehab is actually important because research has shown cardiac rehab can help to save lives. It helps to prevent another heart attack from occurring. It helps to improve the quality of life for heart patients, and it helps to reduce hospital and readmissions, as well as to reduce disability. So in recent review studies published in 2016, heart patients who have attended cardiac rehab could reduce the risk of dying from heart disease by 58%, reduce the chances of another heart attack by 30%, and stroke by 60%. So cardiac rehab patients are also less likely to be readmitted to hospital by 18%. There were also shown to be improvements in terms of physical function, body pain, general health, and mental health.
Okay, so what actually, what processes?
The processes of cardiac rehab actually, there are actually 4 processes. But before you can get into cardiac rehab, in general, most cardiac rehab programs will require a referral from a doctor. The doctor may not be a cardiologist. He can also be the family physician or GP who is taking care of the heart patient after the event. So cardiac rehab starts right after the medical therapy or surgical therapy of the heart patient in the hospital. So there will be a team of doctors, nurses, and allied health professionals, who includes the physiotherapists, may include the occupational therapists, and other allied health professionals to see the patient by their bedside. So in terms for the physiotherapists, they will usually check the patients for their mobility, as well as whether the body can tolerate physical activities. Usually, light activity is encouraged. Examples of a light activity includes a normal walk and activities of daily life, such as your usual grooming or going up and down the stairs if the patient does not live on a lift landing apartment. So, or even doing little things such as washing of cups and dishes. These are things that we advise, as a physiotherapist, advise the patient by their bedside. In phase 2, it occurs in an outpatient setting. So the therapist, or rather the patient, will undergo an assessment of medical and physical condition again in the outpatient clinic, and the physiotherapist will initiate an exercise program for the patient. Phase 3 is about progression of exercise for the heart patients. The exercise in terms of intensity is increased, and specific strengthening exercises for work or specific sport is introduced to the patient. The aim of phase 3 is to integrate exercise into the patient's daily life, finding activities and intensity that suits the patient best to ensure a smooth transition towards taking charge of his exercise habit. Phase 4 is what we call a lifelong or maintenance phase. So in this phase, patient is mainly in charge of his own exercise program. So, and he determines when help is needed. The physiotherapist can help to reduce the risk of injury. As I mentioned, phase 4 is a lifelong. So it is important to reinforce safety precautions regularly to the patients in this phase, as some people do forget what they have learned over the period of rehab.
I see. So are we saying that after a cardiac event, that cardiac rehab is a lifelong exercise?
Yes, so that's one thing to remember. Heart patients do face a risk of having another heart event occurring, especially in terms of if they do not take care of their heart condition well. So it is important for heart patients to remember what has been taught so that they do take note of signs and symptoms of another heart event occurring. So these are part and parcel of the process of cardiac rehab.
I see. Are they at higher risk if they suffered like a cardiac event before? Are they at higher risk of suffering another cardiac event?
Yes, compared to the average man on the street, they actually have a higher risk of having a heart attack or heart event occurring again for these people.
Okay. So I mean, I can see why cardiac rehab is quite important.
Yes.
Okay, so let's go on to the next one. Okay, so I mean, there are different kinds of cardiac events, right? Of course, the one that we're most, used to is the heart attack, or, that's the one that we see in the
Yep.
movies or in the dramas and things like that. So first of all, maybe you can let us know, what are the different kinds of cardiac events? What are, from the least serious all the way to the most serious? And do all heart patients need cardiac rehab?
So basically, I would think that all heart conditions carries their own seriousness, and we do need to heart patients do need to pay attention to their heart health. So basically, anyone with a heart condition should, or rather, require some form of cardiac rehab. So you have mentioned, as we mentioned just now, people with a heart attack, people who have undergone a heart procedure, such as what I mentioned just now, coronary artery bypass grafting, in short, is known as CABG. People who has undergone a stent or balloon, people who have a valve replacement or repair, and people who had an insertion of a pacemaker. On people with heart disease diagnosed, but they do not have any symptoms, they should also learn how to take care of their heart health. And some people have a blocked artery and they have what we call stable angina, which means chest pain whenever they exert. They should also learn how to take care of their heart health. What we have another group of patients, what we known as heart failure patients. If they are under stable and chronic stage, they should also undergo cardiac rehab. And other heart conditions such as atrial fibrillation. So all these people can undergo cardiac rehab. Of course, there are situations when they may not be suitable to start off exercise therapy immediately. So it is very important for these patients or these people to consult their medical team before embarking on an exercise therapy.
I see. And we all of us, have this idea that heart attacks are people that, are things that happen to people who are generally elderly and overweight. But maybe you can give us like some background on what actually are the age ranges with your patients?
Well, so far the most of the patients that who come from cardiac rehab, they usually are from ages 50 and above. That is the most common because that's when a lot of chronic disease also set in. However, we do see an increasing trend of young patients suffering from heart attacks or other heart conditions. The youngest I could recall is actually is a male who is about 26 years old.
Wow. Okay.
Yes, so it does. There is a trend, and all the more is important for young heart patients to really take care of their heart health, because they do have a long way to go. They are usually the one who just set up their own families, and they have to take care of the families. So all the more it is important for them to undergo some form of cardiac rehab, so that they can reduce the risk of another heart attack or heart event occurring again.
Right, right. Could you share with us maybe like one story, one success story or one patient that really impacted your life?
Sure. Yep. So we actually have a male heart patient who worked at Changi Airport. So he was always typically he's overloaded with work. He doesn't have a regular schedule, and one day he experienced chest pain and cold sweat before lunch at work and was immediately hospitalized. So he was diagnosed as having a heart attack, and a stent was inserted. Before the attack, actually, he led a pretty much a sedentary lifestyle and was slightly obese. He did not know how to incorporate exercise into his life, so approached Rehab Paradigm for help. His other known risk factor is actually high blood pressure. So this client started on cardiac rehab, but could only commit once a week, and we work with that. So this regime continued for 3 months, and he wanted to continue exercising with the physiotherapist, as he thought he would not be able to adhere to the exercise program himself. At this point, the physiotherapist had actually managed to commit him to a 10-minute brisk walk twice a week as part of home exercise. The physiotherapist subsequently introduced him to an exercise physiologist to continue his exercise sessions, as he also expressed he wanted to go back to his favorite sport, which is deep sea fishing. So the exercise physiologist advised him on the precautions and contraindications of that sport and gave him a regime of conditioning exercise. After a series of conditioning exercises, this client subsequently went for a medical review and was given the green light to resume deep sea fishing. The client was delighted, and he sent us a photo of an 8-kilogram fish that he caught on his first trip. On top of that, he also committed more times to exercise in his daily life. So we are very happy that actually this patient, the cardiac rehab program had actually achieved its goal for this client to integrate exercises and make changes to his lifestyle.
Oh, very nice. So because of you, he was able to go back to his deep sea fishing.
Yes, actually, we're very happy actually that he actually goes back, he gets back his quality of life. He becomes in terms of physically, he becomes fitter, and he can manage his heart health much better now.
Actually, I don't know what is deep sea fishing. Does he have to go into the ocean or he just sit on the boat?
No, actually, he's going out to the sea, but of course, you have to so-called handle the difference, the technical difficulties of fishing in the open sea. So this is what
Oh,
happens. Yes.
very nice. And that, I guess that's important because, he'll be far away from the hospitals and medical
Yes,
attention.
he actually will be far away on hospitals, and you actually will be you have to so-called and also help with the different. I mean, in the open sea, there's also other weather conditions and things like that you need to handle, and you also need to some equipment which are not we are actually can be quite heavy. So these are things that he actually can have to manage if he goes out to deep sea fishing compared to a pole fishing by the river or by the sea.
Right, right. Okay. So, I mean, of course, I think family support is very important, in any medical condition. But when the heart is so, vital to survival, I'm guessing that, family support is important. So,
Yeah.
can you just let us know like a bit on how the family can support, someone who's going through cardiac rehab?
The family actually plays a very important role on the road of rehab. Okay, so in terms the family provides support to facilitate lifestyle changes, such as the person who is in charge of buying and cooking food. This person should understand the principles of a cardioprotective diet, which means cooking food that is healthy for the heart. Another example would be the spouse or even family member going for regular exercise with the heart patient. Okay, then families can also discuss the program together when they're at home or away from it and remind each other of their goals, which so that they can improve the adherence to the treatment and increase motivation. So lifestyle change is also more likely to be sustained in the long term if the support from the family member is continuous. And on top of that, the family members actually benefit from being involved in the program by reducing their own cardiovascular disease risk. because a lot of times they do share the same lifestyle factors. In like, let's say for the family, if they cook the food, it's usually shared among the family members. So if you're indulging in the usual food is high fats, a lot of high sodium. So actually they do share the same risk factors, and it's important for the family members to take care of the heart health as well.
Right, right. So aside from, family and of course yourself, who else, should we include in this circle, in this heart health circle if we're looking after our heart health?
So in terms of besides the family as well as the physiotherapist, actually the cardiac rehab in terms of program actually involves a lot of other professionals in this program. So the nurses are also involved, to which who will educate the patient on in terms of the heart condition. In terms of, let's say, if the heart patient is a smoker, they need to undergo smoking cessation, just to quit smoking, and also to provide some initial counseling and support. So like what I mentioned just now, we're talking about food. So the dietitian is actually also involved, or the nutritionist is involved in this case, in terms of giving proper nutrition advice, what's to eat and what is not to eat. And some people may even need help with planning a meal, because especially in our typical lifestyle, we are always eating out. So what kind of food to choose and how much should we eat? For those who are overweight, obese, and you need to reduce in terms of calorie intake. So these are things that the dietitian or nutritionist are involved with. Then we have about the medications. Many heart patients do take a number of medications, especially if it's not just a heart disease, but they have other chronic disease such as high blood pressure, diabetes, high cholesterol, or many other conditions. And a lot of all these medications can be very overwhelming for the patients, and sometimes they do have a bit of side effects. So the pharmacist will be there to play a role to inform or educate the patients about the medication they are taking. And we have the occupational therapists who will be involved, especially if the patient is engaged in a job or profession that requires certain physical or technical difficulties, or the environment is not as ideal as it is. The occupational therapists can play a role to help the patient in resolving that. Then we have the cognitive part, or rather the psychosocial part, whereby the counselors, psychologists can play a role in helping the patients in terms of motivations, in terms of overcoming mental issues that may face. Some heart patients do feel very depressed or down after a heart attack, and to them it's like coming to the end of the world, and they need more than just a usual social, or rather encouragement to get out of the situation. And what I mentioned just now, the exercise physiologist as well, because come upon a time when there are specific sports that which patients like to engage in, the exercise physiologist will be in a better role to help to advise the patient in terms of moving on to their goals and to their goals.
I see. Okay.
Yes.
So, maybe let me go to the next slide to ask my next question. Okay, so, we've heard a lot about what is done about, cardiac rehab as well as other rehab. So, I just want to understand, how is cardiac rehab done at home?
Well, the cardiac rehab is not just about specialized equipment or high-tech gadgets and things like that, but cardiac rehab can be done at home, because the most important the professionals who are involved in the care. So the physiotherapist will go to the house to do an assessment of the heart patient's condition, physical condition, and we can design specific exercises that can be done at home. We'll try to modify any furniture or equipment that's available at home, and advise patients on how it can be done, and monitor them subsequently. So these are how it's done or in a home environment. So so it's really very much more of the education as well as the advice that the physiotherapists or the cardiac rehab professionals can offer to the patients in helping with their rehab program. Being saying as because having said that, not all heart patients do like to go to a so-called cardiac rehab setting to do rehab as well.
I see. Lovely. So, I mean, just now, you brought up a point about, different chronic diseases. And from my own understanding, chronic diseases are also based on lifestyle choices. So, if you make so-called not ideal lifestyle choices, it's likely that you might have other chronic diseases, other than,
Yes.
poor heart health, like, diabetes and stuff. So I understand that you guys also help people with other chronic diseases. So, for the benefit of our patients, maybe you can explain a little bit about, rehab for other chronic conditions, just an overview.
Yes, so for other chronic diseases, which can be treated by using a primary prevention program, besides people with a diagnosed heart disease, because what is aimed for is actually to be these people to be treated upstream, rather
Mm,
than waiting for that for this chronic disease to lead to a heart disease happening. It is very important to control this chronic disease, such as high blood pressure, diabetes, high cholesterol, what we call a peripheral arterial disease, or even obesity. So these are things that can be prevented or rather be controlled having a lifestyle modification, which includes exercise therapy. Other conditions that will usually impact these people includes in terms of the muscles and the joints. So what we call musculoskeletal conditions such as osteoarthritis, low back pain, spinal cord injury, or even things like stroke and other conditions such as lung conditions. So these are very common in patients, or rather, especially when they reach middle age and above. So physiotherapy can play a role in helping these people.
right. Okay. So we've come to the end of the webinar. Thank you, Hung Yong, for joining
Thank
us.
you.
I think it was a very fruitful session. Of
Thank
course,
you.
to those who have joined us and for those who haven't been able to join us, this webinar is recorded, so we'll be able to share with our entire patient pool as well. So I'm just checking the Q&A in the chats. It looks like there's no Q&A, but feel free to reach out to us, either to us or to to Rehab Paradigm directly if you have any questions, and then they can follow up from there. So again, no Q&A. Okay, so here are the contact details. You can see Rehab Paradigm. They have the number there. Hang Yong, is this the hotline?
Yes, this is the hotline.
All
So
right.
feel free to call us at this number so that we are happy to answer any inquiries. We're also happy to work with SpeakDoc in providing cardiac rehab to patients.
Correct. So if you have a history of cardiac disease, reach out to either Speedoc or to Rehab Paradigm, and we'll, between us, we will understand who is the better one, whether it's more clinical or if it's more rehab based, and then we can refer to each other directly.
Sure.
Also, if you have generic chronic conditions like diabetes, you can, just reach out to either or one of us as well, whether you
Yeah.
need medical support or you need rehab support. And with that, we've come to the end of our lunchtime webinar. We look forward to having, Hang Yong as well as your partners back with us again. But
Thank
for
you.
today, I think we've come to the end of the webinar. And once again, if you didn't manage to catch this webinar, it's recorded and we'll be sharing with all of you guys again. So thank you, Hang Yong, for spending your lunch hour with us.
Right. Thank you. Thank you. Thank you,
All
Serene.
right. Thank you,
Okay. Bye-bye.
everybody. Bye-bye.
Bye.